Hi everyone, I'm Janet Homan and it's great to have you all joining me today. I'm a qualified regression and trauma therapist based in Cape Town, South Africa. In my youth, and that's many years ago, I worked in Groote Hospital, which is the main medical teaching hospital in South Africa. And then I transferred to the main burns unit hospital in Cape Town. What touched me deeply was the amount of trauma that patients and their families had to undergo, not only due to their surgery, but also generally in their lives. Most patients and their families had little or no ongoing support in dealing with their trauma, which I could visibly see and feel hampering their recovery and also the family's day-to-day living. This led me to opening my current private practice, which is based on aiding trauma victims, and have now been there for 16 years. 50% of the world's population will experience some type of trauma in their lives. The stats show that in the next 12 years, each one of the 56 million people in South Africa will have either witnessed or experienced some type of trauma. What's more distressing is that most of the population do not realize that they are suffering from the effects of trauma. With increased awareness, I hope we can help trauma victims to heal and in turn help those who are unaware of the invisible wounds that trauma may have inflicted upon themselves, their families, and how it has and still is impacting their lives if untreated. Most of us think of victims of trauma as those who've been to war, commonly known as PTSD. But there is another type of trauma which has been quietly developing and growing in the shadows and has only in the last 6 years been acknowledged by the medical fraternity, namely complex trauma. Complex trauma is when an adult or a child witnesses or experiences repetitive events over a period of time involving neglect, physical, emotional, sexual harm, or substance abuse from the very ones we deem our caregivers or those we deem trustworthy. Being a victim of complex trauma myself through sexual abuse as a child throughout to my adult years, I have an in-depth understanding of how important acknowledging and healing complex trauma is. If untreated, it will have profound effects on your future relationships, social skills, financial opportunities, your physical health, and may even lead to a perpetuating cycle of trauma within family units. Now that sounds like all doom and gloom, but this is where it gets exciting. You don't need to stay locked in your trauma, so I invite you to stay with me now. Even if you are not a victim of trauma, you may know someone, a spouse, a child, a friend who is in need, or just by understanding the mechanisms behind trauma and our unconscious reactions, you can help those who are victims of trauma get through each day to become a survivor and thrive. How do we as trauma victims actually feel? As survivors of trauma, we struggle to be in touch with our feelings. We dissociate and stay unconnected to our bodies, often confused by the overwhelming emotions and reactions welling inside of us. Most of us were told, whatever's troubling you, it can't be that bad, just let it go. To top it all, if we actually got up the courage to express our feelings in some way, we were either punished or dismissed, ignored, or told that it sounds like a bit of a tall story. Sound familiar? Every person has at one time or another felt the uncontrollable feeling of their heart racing, their breathing increasing, palms sweating, and anxiety. And generally this happens when you're in a stressful situation. Exactly like during exam time. We've all been through that. Starting a new job or going out on that first date, which is a normal response called the flight, fight, and freeze response in the body, and usually subsides after we understand there's no actual danger. But what if you feel all these things and more, and you don't even know why it's happening and what caused it? And it happens so often that at some point our bodies think this is how everyone lives. Trauma comes in different forms and different degrees, and our bodies store and record it all. No matter how big or how small we perceive the experience to be, without an explanation, the body will hold on to the feelings and will not be able to just let them go. Let's take a simple example. A young child is left at school, not because the caregiver or parent didn't care, but because they got caught up in a meeting. The child may feel the emotion of abandonment at that precise moment, and if the parent or caregiver does not explain to the child the reason for being late and allow the children to express those feelings. Please note, the most important thing is for the child to express the feelings. The emotion the child felt could be held in their little psyche and physical bodies. Now, moms and dads and caregivers, this does not mean that you are awful parents, not at all. It's about explaining that awful word we all hate so much, the Y word. Our brains need reasons in order to process and discard emotions that don't serve us. So letting go can only occur once the experience is understood and the emotion is truly felt and expressed outwardly. In complex trauma, victims are usually not given an explanation or allowed to release the emotions. So the body holds on to the emotions and the body stacks them up. Eventually, all these emotions are like adding clothes into a washing machine. We just keep adding and it keeps churning and churning. Ask any victim where they feel the most in their bodies. It's the stomach churning. Our very own in-house washing machine of emotions. Eventually, this washing machine is so jam-packed with emotions. We don't even know how to name the emotions. We become afraid to even feel a happy emotion, as the rest may just pop out of that damn washing machine, and then how do we handle it? We have learnt not to be seen, not to be heard or believed, so we need to keep that washing machine door shut, and so we don't actually feel. It's not safe. The most important word to any trauma victim is the word safe. The one aspect that will rule our lives from the time of the traumatic experience until we release the unsafe feelings and emotions. The one four-letter word that we have never felt, and if not allowed to feel, will destroy the quality of our lives. Then to top it all, we have these silly aspects called triggers, which take place at any time and in any place and in any situation, which make us the weirdest on things and the weirdest on people. So what do? We try to control, but we don't, and we can't. And we can't explain it to ourselves, never mind to others. This results in us being labeled as a naughty kid at school, or a non-compliant or even a perfectionist in our work arena, anxious 24/7, feel numb in areas of our body that we have never felt numb in before, and try to control all situations to feel safe. We look for exit in unfamiliar places or situations, feel the need to stay away from crowds, struggle with forming relationships or friendships, and finally, we are somehow different, as everyone else seems to handle these things on a day-to-day basis. We develop undiagnosed digestive problems or unexplained medical issues, with labels such as psychosymptomatic disorder, yet another unexplained aspect of our lives. Finally, too embarrassed about feeling broken and hiding the chaos we feel inside, yet not understanding why. This causes us to push everything away, the people we love and the people that want to love us. Opportunities in life we push away. Having fun, joy and humor, financial security, and may finally resort to alcohol, drugs, sex, eating disorders, body harming or gambling, to name a few. And we do this in order to dull the emotions, or actually feel an emotion. Finally, we may even retreat into isolation. So how do we get there? And when I say get there, is how do we get from being normal to being what I've just described? So let's have a look at our complex trauma and the brain. One of the most common questions I get asked is, how does trauma impact the brain? So let me just correct that train of thought right now. The question we should be asking is, how does trauma impact the brain and the body? We still have a lot to learn about the effects of trauma, but we do know that a number of changes occur in the brain, and most importantly, in the body, that make it difficult for victims to live a life they have dreamed of. In order to understand and aid in the healing of victims of complex trauma, it's imperative to understand how the brain and the body work in processing information we receive from the outside world. Our brains process, organize, store all the information from all our experiences via billions of neural and electrical networks, making it the greatest supercomputer on this earth, and yes, even smarter than those who love Apple computers. But like computers, a surge in electrical activity may cause a malfunction, much like what our brains experience when you and I undergo trauma. Until recently, the medical fraternity had little information on the extent trauma had on our developing brains. But with the help of neuroimaging, it's becoming evident that parts of the brain responsible for processing stressful experiences become dysregulated. This is similar to when our home computers have a virus and the coding goes haywire, and we all know how we hate that. So what do? We need to reboot it. And that's exactly what we need to do to our brains. Reboot the software saved from the certain experiences. It's not the experiences we should worry about. It's the emotions linked to the specific experience. That's what we need to clear. So let's look at it a bit further. There are three major areas in the brain which are affected by trauma. In the brain without trauma, the prefrontal cortex, located near the top of the head, known as the thinking center, is responsible for clear thinking, making good decisions, planning, empathy, and the awareness of ourselves and others. The anterior cortex, known as the emotional center, is responsible for managing our thoughts and emotions. The amygdala is located deep inside the brain and is known as the fear center. Its primary job is to receive outside information we see, hear, touch, taste, and smell in order to answer one primal question: is this a threat? So with the trauma brain, things develop slightly differently. The thinking center is underactive, hampering the ability to reason, pay attention, and think clearly. The emotional center is underactive, causing flooding of unmanageable emotions. Even when we want to calm down, we just can't. The fear center is overactivated, causing the body to remain vigilant, fearful, and unsafe 24/7, and lights up on a neuroimaging scan like a Christmas tree. In children, Their survival functions develop first, and they can register a fear response in the last trimester of pregnancy. And the growth of their neural pathways in the brain and nervous system will be affected, affecting their attention span, learning, memory, functions, and coordination, which impacts the development of their schooling and social skills, and if left untreated may cause many ramifications later in life. So this is why we told pregnant moms to be as chilled and as relaxed as possible. So when people say to traumatized people, "Oh, it's all in your head," you don't have to feel embarrassed, as yes, it is all in our heads, and there is a malfunction. So let's look at what actually happens in our brains and bodies in complex trauma. 24 hours a day, your brain and body are receiving and encoding electrical and chemical impulses depending on the stimuli you receive from the outside world. Your nervous system tells you and your brain and your body what to do. Process this, dump that, store this, react to that, or don't react to this. And it usually works very effectively. In a traumatized brain, all this goes haywire. Your primal fright, flight, or freeze response is triggered and remains on high alert 24/7, sending masses of amounts of stress hormones like adrenaline and cortisol into the bloodstream, again 24/7, filling your bloodstream with alarm signals to get out, react, go to safety, get to somewhere you are protected. As I said before, and I'm sure I will keep saying it, if you do it often enough, the brain will program itself and identify this as a normal everyday behavioral reaction. And this becomes programmed as the body's norm. Let me say that again. So in traumatized victims, their bodies become programmed as if to be on high alert every day, all day. It's like a computer popping back in its automatic default system which has been set up, and no matter how hard you try to tell your brain and your body not to react, it does. For example, have you ever tried to unride a bike? I don't think there's even a word like unride a bike in English dictionary, which exactly what I'm saying. So your brain learned to ride that bike, and this was set up as an automatic default system from your stored memory in your subconscious mind. You can't learn to unride a bike. As I stated before, the thinking part of a traumatized brain is underactive. So any type of reasoning goes out the window. The emotional brain kicks in and focuses on getting you to safety. Therefore, the memory of the incident does not get fully processed, but it is fragmented, which is the reason many trauma victims have gaps in their memory, or no memory of the trauma at all. Yet the body will still display all the usual signs and symptoms of the trauma. And I'll repeat that. So even if the trauma victim does not remember the incident, their bodies will still display every symptom that a person who remembers their trauma, making the victim even more confused than normal. So when someone tells a victim that they are over-emotional, yes, they are correct, but they have no control over this. Understanding this aspect allows a victim to understand that they are not going mad. Their brain isn't actually doing what it was programmed to do, and it is doing what it has been recently programmed to do, and that's keep it safe. Many victims find it difficult to remember the timeline of an incident because the thinking part of the brain is underactive. Confusion between the past with the present due to the fragmentation of the whole memory may result in certain smells, touches, a tone of voice, a place or a situation triggering a panic attack for a trauma victim, making them feel as if they are actually going through the trauma in the present moment. So the next time someone tells you that you're overreacting and just calm down, remember that your brain has been dysregulated and your body is just doing exactly what it has been taught to do from past experiences. It is protecting you, and it's not your fault. When a person experiences physical, emotional, or verbal abuse, it will be processed in the same way. The brain and the body do not differentiate between the type of abuse, which is the reason so many victims of verbal and emotional abuse go untreated. For victims of verbal and emotional abuse, how do they show you the pain, the hurt, the shame? Especially if it cannot be seen by the naked eye. This does not mean it's all doom and gloom. The brain is what we call plastic, and you can change and mold it, and the body will follow like a computer once rebooted. But before we move to how we reboot, let's chat about how trauma affects the body. As we now know, trauma is acknowledged by the body as an extreme stress and produces large amounts of hormones to activate our fight-flight response. These hormone levels are not natural to the body, and when there is an imbalance in the body, something usually is affected. Cortisol and adrenaline, as you now know, are produced in large quantities, which requires increased bodily energy to be formed, and results in the adrenal glands at the top of the kidneys becoming fatigued. They flood the blood system with glucose and may cause diseases such as diabetes or glucose intolerance. The digestive system is already churning like a washing machine with anxiety, causing a nutrient absorption deficiency in the gut, and to top it all, 50% of our natural happy hormone dopamine is produced in our guts, and the other 50% in the brain, and they're all malfunctioning. So no wonder depression hits in a big way, as these levels are substantially reduced after trauma. When the fight and flight response is activated, the body conserves all its energy to respond to danger, diminishing energy to function the immune system, and over a long period will eventually collapse. So dis-ease in the body begins to thrive, and the body may begin to show physical signs as certain diseases, which there are many. I will just name a few. For example, digestive complications, headaches, muscle aches and pains, mental disorders, unexplained autoimmune disorders like ME, fibromyalgia, non-genetic arthritis, thrush, kidney disorders, high blood pressure, and heart problems. So how do we reboot the supercomputer called our brains so our physical bodies are not affected? Most therapies are based on talk therapy, which focuses on the thinking brain. And as I have just explained, the thinking brain of a victim of trauma is underactive. So here's the problem. If we as therapists just focus on the conscious thinking brain, trauma victims may cognitively understand where the trauma stems from and how their bodies are reacting. But is it enough to reboot the brain and the body to react in a normal way? Please don't get me wrong. There are many of you, I suspect, where talk therapy healed your trauma. But for those who are still feeling stuck, the trauma in the body needs to be addressed. Especially for those suffering with complex trauma. The mind and the body needs to be healed together and not separately. If the conscious mind is the only part that is targeted, will the body follow? No. As the subconscious mind and its learned reactions, by this I mean your default settings formed from trauma will feel healed for a while, but then the cycle will begin again as it goes back to your default program. The whole system needs to be rebooted. So how do we actually achieve this? For over 16 years, I have been helping complex trauma victims, and I will be sharing what has been helping my clients to live, laugh, and love life. And as I have found that not one treatment fits all. The most important aspect in treating you as a trauma victim is to individualize your treatment, as each of you will be at a different stage in your healing process. Usually a combination of holistic approaches needs to be utilized to meet everyone's individual needs. Before we dive deep into the treatments, the most important factor in the healing of complex trauma is to provide a safe space. The biggest factor that victims deal with is lack of trust and wanting to feel safe. Expect each and every trauma victim to test everyone that offers them help, as this is once again going back to that default program set up with caregivers and those they deem trustworthy, but actually weren't. So therapists and victims alike should not be alarmed by this behavior, as this will occur in cycles of trusting, non-trusting, and trusting, until the body emotions and triggers have been released. Please note that the therapies I will be outlining are in no specific order and may not be required by each individual. Drug therapy, antidepressants, anti-anxiety meds, etc. This is very individual and is generally given depending on how you are coping on a day-to-day basis with normal life and how much natural happy hormones are being released in your body. There is a place for everything, but what is evident is that many trauma victims are put onto medication for long periods of time, and in many cases years, which dulls and suppresses the very feelings which need to be addressed and brought to the surface in order for the body and mind to heal. But it does depend on how severe the victim is reacting. So yes, drugs are a source of treatment. Talk therapy. This targets your conscious mind and will allow you to organize and understand certain aspects of your trauma, but may not reboot your body reactions to the outside stimuli, as I've already explained. Mindfulness, which includes meditation, yoga, hypnosis, etc. Generally, the holistic programs. Once again, this therapy needs to be introduced when your body can cope, bearing in mind that most trauma victims are in a state of high alert. And to expect a trauma victim to sit still and go within and feel their emotions is exactly what they have been avoiding for the whole of their lives, and may make victims very uncomfortable. As a victim, you already feel like a failure and have low self-esteem, and not being able to perform mindfulness may cause them to feel even more disempowered, more embarrassed, fueling over our low self-esteem. This therapy needs to be introduced once the body and mind has normalized the fight and flight response. If done too early in treatment, it can actually cause more trauma to the body. Embedded cellular body memory therapy, coupled with or without regressional hypnosis. The body keeps a score, and I use embedded body therapy alone as my first healing modality. Certain techniques are used to help the body feel and release your embedded cellular trauma, allowing the body to do what it should have done at the time of your trauma. All traumas are due to an inescapable disempowerment, which causes the brain to become a little haywire and sets up a frantic reaction of panic and fear. In order to reboot the brain, action is required at a bodily level as well. This action is not just any action like sport, hockey, tennis. It has to relate to the triggers which have been set up in the body. So I'll give you an example. When you experience trauma, the brain goes haywire and you lose your skill to take action. In order to reboot the brain, the body needs to take action and react. Let me repeat that. In order for the brain to be rebooted, the body needs to take action and react towards a similar trigger. For example, if you fell off a horse, and please, those who have fell off a horse, I hope I'm not triggering you right now. So if we fall off a horse, we are told to get back onto the horse as soon as possible. Now there's a mean in this madness, okay? The action is falling off the horse. The reaction is getting back onto the horse, feeling empowered. Do you understand? If this is not done, the brain will not reboot, causing a trigger to be set up, and all horses are labeled, I am powerless. Whenever I see a horse or any animal similar to a horse. The reaction is when the rebooting of the brain and body actually takes place, setting up a new emotion that you and I are not powerless, in this case towards horses. So let's take a few steps further. And no, we don't have to run finding horses. This is where the wonders of the brain are actually useful. Using the brain's inert imagination and creativity capabilities, regressional hypnosis coupled with body work to reboot the brain is used, dissolving your reaction of your being disempowered towards the horses or a traumatic experienced trigger. So that's how we get rid of triggers. Regressional hypnosis coupled with behavioral therapy. Once the body has released its embedded trauma, regressional hypnosis and behavioral therapy is used to reprogram the patterns that have been set up in one's life due to a traumatic experience. Fragmented memories can be cleared in order for triggers to be halted. Remember the horse? Mindfulness can now be used as your body can now access your natural, relaxed state, and reflection on the inner you and who you truly are as a person will surface. The brain and mind and body have an innate ability to store memories, and once you release the hurt, the pain, the shame, grief, guilt, and sadness, and many more emotions, the brain and the body will self-heal, and all that will remain will be in a past experience with no effects, no triggers or emotions, allowing you to fully live, laugh, and love life, and experience life to its fullest, as we all so deserve. I thank you all for taking the time to meet with me today, and I hope I have shed a little light on what is a very vast subject. Hopefully, I have allowed many of you to become more aware of others and maybe your own invisible wounds. And if you are a victim of trauma, just know that you are already one step towards being a survivor.